Pretty sure it's Carol that talks about it. Her approach is acquired psychiatric disorder or something like that. What's that about, and what are your thoughts there?
Well, the acquired psychiatric disorders is just this broad, encompassing any and every problem that a vet has with a mental health condition. I put mental health condition. She's had a lot of success with putting that in, and then it makes the VA kind of search, well, what is this? What could it be? Or they'll actually just use that term, acquired psychiatric disorder. She's trying to just hand it up on a plate to them, saying, just put this. Clearly the veteran has a mental health condition, just put this. And so I'll put mental health condition, but that makes them define it, which, VA has to do more work. And as you would say, just give it to them and let them pay you.
You're going to need medical evidence if you want to win your VA claim. You need a current diagnosis, current symptoms, and a nexus. If your doctor won't give these things to you, check out my med team. There's an email address in the description.
But yeah, that's, what you just said with the PTSD is we have a lot of vets come to us say, hey, I have PTSD, and I'll look on their code sheet and they're being rated for anxiety at 30%. And I'll be like, look, they labeled it. Okay. Did they label it wrong? Probably, but we don't care about that. What we care about is getting you up. You have suicidal problems. You don't like people. You can't keep relationships. That's a 70%, if not 100%. Let's let them name it, but let's make sure they pay you.
A 70% mental health rating is so common. Once the veteran, you have to get real with yourself and your problems, and then you need to be able to tell them and tell your story and be convincing at the CNP exam. But yeah, a lot of people are underrated, and 70% mental health rating is, if you don't have that, that's the first place I would go pretty much 100% of the time. That's a big moving claim if you're down low or you don't have any mental health rating at all. VA claims are all about strategy. I preach and I teach strategy in my boot camp. Check it out at combatcraig.com. Links in the description.